The sheer scale of the COVID-19 pandemic, it really was a stark reminder, wasn't it? How connected we all are.
Absolutely. And it really, exposed some critical weaknesses.
Big weaknesses in our global health setup. But there's been a really significant development, something that could change how we face future crises.
You're talking about the new pandemic agreement.
Exactly. The World Health Organization member states have adopted the world's first pandemic agreement. This isn't just like another policy paper.
No, it's potentially transformative. A big step towards a more secure and, crucially, more equitable future for global health.
And that's what we want to dig into today. We're going to unpack the key aspects using information directly from the WHO.
Right. It's the result of, over 3 years of intense negotiations?
Yeah, prompted directly by those gaps, and importantly, the inequities we all saw during COVID-19.
Thinking back to those early days,
hmm
the scramble for masks, the huge gaps in vaccine access later on,
It was stark.
this agreement is really about learning from that, trying to build something more resilient.
Okay, so let's get into the core of it. What were the main drivers? What need is this really trying to address?
Well, the overwhelming driver was just the devastating impact of COVID-19 globally.
The loss of life, the disruption.
Exactly. The economic fallout, the social disruption, it all just underscored this urgent need for a stronger, and I have to keep saying it, a more equitable international way to handle future pandemics.
Moving beyond just reacting.
Precisely. Establishing a more robust, sort of pre-agreed framework for working together globally.
Makes total sense, especially now. So what are the actual, the nuts and bolts? What principles, what tools are we talking about here?
Okay, so the agreement sets out guiding principles, different approaches, and practical tools, all aimed at better international coordination.
Covering the whole life cycle.
Yes, the whole spectrum.
Yeah.
From prevention, trying to stop outbreaks happening, to preparedness, being ready if they do.
And then the response itself.
Right. A more effective and, crucially, a fairer response. And a key part of that is this explicit commitment to equitable, timely access to the essentials, vaccines, treatments, diagnostics.
That access issue was huge during COVID. Now, a big question that always comes up with international agreements is national sovereignty. What does this agreement actually say about that?
That's a really critical point, and the agreement is very clear on this. It directly addresses those concerns.
How so?
The text literally states, and I'm paraphrasing slightly here, but basically, nothing in the WHO pandemic agreement shall be interpreted as providing the WHO Secretariat any authority to direct, order, alter national laws or policies.
So no power to tell countries what to do domestically.
Exactly. Or to mandate specific actions. Things like banning travelers, forcing vaccinations or lockdowns. The agreement doesn't give the WHO power to impose those.
Right.
It firmly respects that national governments decide their own laws and policies.
Okay, that clarity is definitely important. So what are the immediate next steps then? How does this become, real on the ground?
The most immediate and probably the most crucial next step is negotiating the pathogen access and benefits sharing system. You'll hear it called PBS.
PBS. Okay.
There's an intergovernmental working group, an IGWG, actively drafting and negotiating the details right now.
And when do we see the results of that?
Their progress, the outcome, will be looked at during next year's World Health Assembly.
And what's PABS trying to achieve in simple terms?
Basically, it's about setting up a clear, fair system for how countries share access to the genetic information of pathogens.
The bugs that could cause pandemics.
Exactly. And just as importantly, how the benefits that come from studying those pathogens, like new vaccines or treatments, get shared globally. It's about fairness in that exchange.
Got it. Sharing the bugs and sharing the cures, basically. What other concrete mechanisms are being set up?
Well, beyond PABS, the agreement also calls for setting up two other key things. First, a coordinating financial mechanism.
For funding.
Yes, to make sure the money is there for global pandemic prevention, preparedness, and response efforts.
And
The second is a global supply chain and logistics network, the GSCL.
Tackling those supply chain nightmares we saw.
Precisely. The aim of the GSCL is to boost and streamline how essential medical products move internationally, identify and remove bottlenecks.
To get supplies where they're needed.
Right. Ensuring equitable, timely, rapid, safe, and affordable access for countries in need during emergencies. Those supply chain disruptions were a major lesson from COVID.
Absolutely. They had huge consequences. Now, what about the role of pharmaceutical companies in all this, especially regarding that equitable access point?
They have a really central role, particularly within that PABS framework we talked about.
How so?
The agreement outlines their commitment to give the WHO rapid access to a pretty significant chunk. The target is 20% of their real-time production.
Of vaccines, treatments, tests?
Yes, of safe, quality, effective vaccines, therapeutics, and diagnostics, specifically during a declared pandemic.
And how is that 20% distributed?
Crucially, the distribution will be based on public health risk and need, with a special focus on the needs of developing countries.
Okay.
It really underscores that core principle of equity running through the whole agreement.
This really does feel like a landmark moment in global health governance. Is there any historical comparison, anything that helps us grasp the significance?
Yes, actually there is. This WHO pandemic agreement is only the second international legal agreement negotiated under Article 19 of the WHO Constitution.
Only the second. What was the first?
The first was the WHO Framework Convention on Tobacco Control. That was adopted back in 2003.
Okay, the Tobacco Treaty.
Right. So that parallel really highlights the potential long-term impact and the legal weight this new agreement could have in shaping global health cooperation.
And for listeners preparing for UPSC exams, understanding that legal basis, Article 19, and this historical context.
Oh, absolutely crucial. Knowing the precedents for international agreements like this is very important.
So what's the timeline? When do all these measures actually kick in and take effect?
It's a multi-step process. First, that specific annex about the PADS system needs formal adoption by the World Health Assembly.
Right, that's next year.
Then the whole pandemic agreement opens up for member states to sign.
And then individual countries have to act.
Exactly. Each nation needs to go through its own internal process for ratification. That usually involves their national parliaments or legislatures.
And when does it officially become binding?
The agreement formally enters into force once 60 countries have completed that ratification process.
60 countries, okay.
So while the adoption is a huge milestone, there's still quite a bit of work ahead at the national level to make it fully operational.
Okay, so just to quickly recap for everyone listening, this WHO pandemic agreement is fundamentally about creating a more equitable and coordinated global response for future pandemics.
That's the core idea.
It's prioritizing things like access to essential medical products for everyone, setting up better financial and logistical systems. And importantly, while it respects national sovereignty, it's really aiming to boost international cooperation when we face these global health threats.
Precisely put. It's a framework built directly on those hard lessons from COVID-19. The big goal is to ensure the world is better prepared and responds more fairly and effectively next time around.
And for those of you focusing on UPSC prep, this agreement is a really significant development.
Absolutely. It touches on international relations, global health policy, international law, equitable resource distribution.
All key areas.
Understanding its nuances will be highly relevant for your studies, definitely.
So as this landmark agreement moves towards actually being implemented, it really makes you think, doesn't it? How might the whole landscape of global health governance change?
Yeah, what role will national policies play in making it truly effective when the next crisis hits?
And thinking back on COVID, what else might be needed? What other mechanisms or areas of cooperation do we need to build a truly resilient, truly equitable global health system for everyone?
It's definitely something to keep thinking about. That balance between global frameworks and national action is key.
It raises fundamental questions about securing global health for the future.
Indeed.
Well, if you found this deep dive into the WHO pandemic agreement valuable, especially if you're tracking these things for UPSC or just interested in global health,
Please do like and subscribe. We'll have more analyses of important global issues coming up.
and if you have questions or your own insights, please drop them in the comments below. We'd love to hear from you.
Just a reminder, all the information we discussed today comes from materials published by the World Health Organization, the WHO.